Dr. Karolina Pras, welcome to the Tick Boot Camp podcast.
Hi, hello. So
So,
nice to
Doc,
finally meet you.
yes, it's nice to finally meet you as well. And but before we step too far forward, your entire last name is not Pras. So, why don't you first help our listeners to describe or to hear the proper pronunciation of your last name, since I am not capable of pronouncing the whole last name.
Praškevičiūtė. Simple,
Uh,
right?
Oh yeah, simple, very simple.
Yeah.
Well, I appreciate you anglicizing your last name as you begin to make your way through the citizenship process here in the U.S. So why don't you share with us where you're from?
I am from Lithuania. That's where I grew up, and that's where I spent two-thirds of my life.
All right, and when did you come to the U.S.?
Full time, I moved here 5 years ago.
Okay, but the answer implies that you were here less than full time earlier than that. So when did you first begin your American experience?
Well, first time I came here maybe 13 years ago or 14 years ago. I explored it all. I went to many states, visited many places. I liked it a lot. But when I lived among different places, like I did my clinical practice in Hong Kong, I stayed in Asia, worked in Asia, then I tried to live in London because it's like an epicenter of Europe. So it's been good, but then I don't know, many life circumstances, and during COVID, decided to try United States. Like, why
All
not?
right. So
Yeah.
the multinational, multilingual Dr. Carolina decided that she was going to make America her home. So give us a little information first about your childhood and what your experiences were like growing up in Lithuania.
Well, now looking back, I really appreciate growing up there. At the time, I didn't know how it is to grow up elsewhere, but now observing other different lifestyles, like including safety component. We've been unsupervised, independent kids. We would do everything we want anytime. Like after school, we would go by ourselves to activities. 8 years old, you take a bus, you go to another town, like everything we used to do unsupervised. I just didn't know it's not everywhere like that. It was super safe. Another thing I really appreciate, we spend a lot of time in nature. So our cities, two largest cities, are 500,000 people each, which is like very good size, I would say, to grow up because you get everything you need in that place, but it's not too big and not too chaotic. You can escape the city within 15 minutes. So just having that, I do appreciate a lot. There's a lot of greenery, forests and lakes. So yeah, both are good things. Winters are dark and long. This is a little
Oh,
of a negative side. So that's been challenging. People have two different personalities, summer personality and winter personality.
all
It
right.
it impacts us deeply.
So there's a dark personality when it's dark and a light personality when it's light.
Yeah, it's giving seasonal depression vibes and it's like not fun. But when the summer starts, everyone is extra happy. People are celebrating each day, which makes it so vibrant and such a happy place if you visit it at the right time.
Okay, or not a happy place if you visit at the wrong time.
Yeah, like February, early March, January, it's like not fun. People are a bit grumpy.
All
We like to
right.
complain.
All right.
Yeah.
So, any of our listeners who are considering going to the Baltic states, they may want to avoid the January, February, March window when it's dark and people have dark personality. So, talk to us about your educational experience and when you began to get the sense that you wanted to study in the medical community and the healing arts.
Since childhood, I grew up in a very medical family. My mom is general practitioner. Her dad, her brothers were all doctors, professors, and I just appreciated. I really saw how much happiness it brought to my mom's life, how much purpose this profession brought to her life. Although I've been a little bit torn because I also had huge curiosity for so many other things. So I'm like, yes, I love medicine, but once you choose that path, you have almost no time for anything else. So I loved sports. I was very athletic. I loved arts. I used to do another like school. Besides my regular high school, I would do art school every day for many hours as well. So all these things, I'm like, I was a little bit torn, but medicine made the most sense. And I just applied to medical school. I knew I gonna get in because it's based on your exams, how well you pass it. So I'm like, yeah, I got scholarship and everything. So I just went through it. Eventually, I started seeing flaws in the system around like mid of medical school. So that was a bit discouraging, but I didn't know what to do. Like, I'm not a quitter. I won't quit. I'll finish this. I'll figure this out. And then I worked some clinical jobs and realized it's just not for me. I think the last modules on the 6th year of medical school were like the most eyes opening, where you have geriatrics and you just put people on more and more medication. They're already taking 30 different drugs, and then you put on more drugs, and nothing is getting better. Like, they are not getting any healthier, and it just didn't feel right to me. But at the time, I couldn't find another way. Like, integrative functional medicine was not a thing back then. Maybe there were some naturopaths in Lithuania, but I never crossed paths. Like, people are really into herbs and everything that, but somehow these worlds are so disconnected that I never got a chance to experience that more, to study that more. So then I just started looking for different jobs, different careers, and explore it.
All right, so
Until
but before you go there, let's review some of your experiences as a medical student, because this is important. Um, there seem to be certainly two separate pathways that at some point, you have the naturopathic world and you have the allopathic world. And the traditional medical community that you are studying in to become a medical doctor is a great system for the diagnosis and treatment of acute illnesses. But it's not a great educational path for the diagnosis and treatment of chronic illnesses, at least in the US. So talk to us about when that revelation came to you, because you started to hint about the functional world and how that was not a part of your educational experience. But give us the epiphany that you had. You said it's your 6th year, that the module of the 6th year. What was happening during the first 5 years, and why did you believe in the system? You were obviously raised in that system, grandparents and parents who were medical doctors, and what were you not prepared for as a third generation doctor that became eye-opening for you when you got to that 6th year of medical school?
it just, where to start? There were moments even on this first, 2nd year when during classes in school, I would be experiencing very weird symptoms. And I was wondering, like, if I bring up these symptoms to someone here, this institution has no answers. Let's say metallic taste in mouth. Like, they don't have answers to those, but this is obviously your body communicating something. And like, I didn't understand that Western medicine, while I still have so much appreciation to that and so much respect for doctors who keep doing it and sacrificing their time, their life for that, but I didn't understand that it doesn't have all the answers, and I couldn't connect dots. Like, why I thought this is the best of the best, but it's not. It's very compartmentalized. It can help you to a certain extent.
Okay, so you're now also sort of hinting at your health issues. So why don't we build that out? Because we're sort of these paths are already starting to cross in your 1st year of medical school. So why don't you talk to us about your health? What was your health like during your childhood, and when did you start to have symptoms that were causing you to raise a brow about whether or not your medical training was going to put you in a position to diagnose people who were symptomatic the way you were, and even diagnosing your own symptoms?
Well, there were unexplained symptoms throughout my childhood. Let's say unexplained tummy pain. And my mom, she's a doctor. She brought me to so many doctors. No one could answer that. No one. Now, when my whole journey really started like a year ago, I got all this like chronic inflammatory response syndrome, everything like when I started reading on that and learning that 95% of kids who have unexplained tummy pain and that it's not stress, then it's mold. And there was mold under my house growing up. So I had all these like nosebleeds, constant nosebleeds, metallic taste in mouth, weakness. Like I was athletic. I think genetically I'm built well, but then I was pushing through and some sports I had to quit it because I just couldn't keep up. I would crash, I would faint. I didn't understand why. I had multiple allergies. But you know how people say, I've been dismissed by medical system, I've been dismissed by doctors. I dismiss myself. Like I studied that system and really I just learned to ignore those symptoms. So I wish I didn't study medicine when I was figuring out my own stuff because reprogram and unlearn things you have learned, it's really hard. It's really, really hard. That's why I understand why some doctors can be like very narrow-minded and just don't accept information outside because you really invest all your heart, your years, everything to learn these things, and then someone tells you it's not true. Like what you learned is not necessarily true. It's not perfect or it's completely different. So yeah, I really tried to believe a system. That's what I'm saying. But I was always suspicious and couldn't connect dots why it's not working out, why my thing's undiagnosed. So I've learned that, okay, if everything is normal on your labs, doctor cannot find anything, then it's just a way how you build up. That's it. That's you're gonna live entire life with those symptoms. That's the way you are. So I just accepted it until I couldn't push through any longer.
Okay, let's pause there for a second and let's explore a couple of other things before we move forward. So you have these health symptoms that that your mom is not able to diagnose. Your mom is bringing you to many of her colleagues to see if any of her colleagues can assist her in diagnosing her daughter, and they're unable to do that. So you were living with one of the best of the best. You were visiting colleagues who certainly wanted to help their colleague's child get a positive outcome from the experience, but they weren't able to help you. Right. So it's not because they were bad people. It's not because they wanted to gaslight people. It's not because they didn't want to believe you. It's because the training that they received caused them to look through a limited prism, and through the prism that they were looking, they couldn't identify what your chronic illness was. Is that an accurate description?
It's very accurate. Yeah. Yeah. Also, what happens, and many of these doctors really want to help you but don't know how to. Some of them become very defensive, and that's where medical arrogance starts, and that's where gaslighting starts. Like, oh, it's all in your head, you need to see maybe a psychologist and this and that. So I think there are two types of doctors, and I see that pretty often. Like sometimes doctors start their career as being open-minded and softer, but they become very narrow-minded, guarded, and defensive, and that's what hurts patients a lot.
Okay, well, let's talk about that. So did you consider your mother the type of doctor who would gaslight her daughter patient, or was your mother the kind of doctor who wanted to help you but was unable to because of her the prism through which she was trained to view illness?
Well, my mom definitely wanted only the best for her child.
Okay.
So she was not defensive. But even now it's difficult to, like I'm slowly educating her like what's happening. It's still very difficult because she stayed in that system for many, many years. So it is a pretty hard conversation. It's
It is,
difficult to wrap head around.
it is, but well, let's say with your mom for a minute, because it's important for us to empower patients. Because one of the things that Matt and I are the most anxious about as we work through our journey in trying to educate people in the Lyme community about how they can get the best outcome, we often hear people say, you need to become your own doctor. And we strongly, strongly disagree with that philosophy. We do not believe you should become your own doctor. We think you should become an empowered patient who properly partners with a medical professional. So we strongly disagree with that perspective because because we think that will not lead to a positive outcome. In fact, most of the people who argue that are people who are still sick and not getting better, at least based in our experience in interviewing more than 1,000 people who have Lyme disease, right? So I like to explore these issues, especially with doctors like you, and in your case, a third generation doctor who had all of the resources in the world and had people who loved her and people who wanted to give her the best outcome, but could not get a good outcome. It wasn't because you're being gaslit. That's not what was happening here. And I do want to talk about gaslighting a little bit, but let's bookmark that for a second. Let's say focused on the experience you had with your mom. So your mom was not gaslighting you. She wanted the best for you. She just couldn't help you. So she did what a good mother would do, and she did what a good medical professional would do, and she referred you to other professionals, people she respected, people who she cared about, people who she knew would only provide you with the best care. Is that an accurate description of how your mother took the next step when she couldn't help you to diagnose your challenges?
Yes, absolutely.
Okay. So now when you were interacting with these other doctors, these colleagues that your mother entrusted with your care, were they gaslighting you or were they really interested in trying to help you, listening to your symptoms, listening to your challenges and trying to help you, or were they becoming defensive and therefore blaming you rather than understanding that they either had limited training or limited experiences and they couldn't help you? It was actually them, not you.
Where was everything? There were doctors who honestly say, I don't know how to help, and there were doctors that would say, oh, it's all in her head. So there was everything, really.
Okay. So now, if you were, I want you to keep your patient hat on right now, not your doctor hat. Keep the patient hat on. Um, what could you have done differently as a patient, as an empowered patient, that would have allowed you to have a healthier relationship with your doctors so that you and your doctor together could get you to a place where you could be properly diagnosed and properly treated?
I really don't think they even had tools to help me. Like chronic Lyme was not there. It's not recognized by Western medicine. Mold has not been mentioned in medical school programs a single time. Maybe mold allergies, but that's only aspergillosis. That's it. So I don't know what to do differently. They don't have tools. I still would have to outsource and go somewhere else to look someone who specializes in it, and it's probably not covered by any healthcare insurances, but out of pocket.
So let me challenge you there. Let me issue the first challenge because I actually believe most traditionally trained medical doctors do in fact have the skill set to properly diagnose and treat someone with Lyme disease. And that opinion is actually driven by some of the Lyme pioneers Matt and I had the blessing to interview before Lyme disease had even been discovered, or shortly after Lyme disease had been discovered, and there was no standard of care for people with Lyme disease. For example, we interviewed Dr. Joseph Bioroscano. Dr. Bioroscano was one of the Lyme pioneers who was treating patients on Long Island in the 1970s and early 1980s, just before and right after the bacteria had been discovered, and we can talk about that as well. And Dr. Bioroscano was actually able to properly treat Lyme disease patients despite never learning about Lyme disease, it not being so. And it was because he had a sound clinical training and background that allowed him to make observations and have healthy relations with the patients. Now, the downside to being a pioneer, the way Dr. Bioroscano was, is pioneers are the ones that always have the arrows in their back, right? So while he was pioneering this treatment protocol, he was getting all the arrows shot in his back, and unfortunately, he was even called before medical boards, and his license had been, he wasn't suspended, but had to go work under the supervision of another doctor, and he had to deal with a lot of things that current doctors don't have to deal with, or more modern doctors don't have to deal with. But he was able to, because he would listen to his patients and he would watch what worked and what didn't work, and he started to see patterns that develop. His clinical training allowed him to come up with a protocol in the 1970s and early 80s that if you look at it today, you would say, holy cow, he was right. So I think clinical doctors, well-trained clinicians have the tools, even if they weren't given specific training about Lyme disease. I think the breakdown occurs when there isn't a healthy doctor-patient relationship. Right now, let's talk about that for a second. How would you, keeping your patient hat on right now, what is a healthy doctor-patient relationship How does a patient take control of the relationship and make sure that they have a healthy relationship with their doctor?
It's collaboration. It's patient has to be super open and the doctor has to be ready to receive.
Okay.
Yeah.
And so one of the things you just talked about a moment ago was how doctors get defensive, right? And so why do you think doctors get defensive? And what role do patients play in that process?
Maybe how patients come across. I can see patients being hypersensitive and sometimes like intense. I can see that. But some doctors also have, there is also a thing of ego as well.
Oh,
Like
for
I'm a
sure.
hero, I'll help. If I cannot help, then it's your fault. Uh, it's medical arrogance. Unfortunately, it's
Yeah,
very common. So
it is common. There are a lot of different reasons for medical arrogance, and I think we should talk about this so patients can tease through that and still have a healthy relationship with their doctors and not try to become their own doctors, right? Because I think there are a lot of reasons why there's medical arrogance. One reason why there's medical arrogance is because in most cases, medical doctors are the smartest people in our society, right? I mean, you're really, really smart people, and you're always the smartest person in all your classes, and you always have all these talents, and everybody kind of, even before you become a doctor, recognizes you, and you begin to identify as a really smart person. So we have that element that smart people become doctors. In fact, you're not going to become a doctor if you're not really smart, right? So we have this identity issue that long predates them going to medical school, right? Then we have a second issue, right? And the second issue is you're now in medical school. And when you're in medical school, you're being urged to take control of a relationship. You're being urged to take control of the needs of your patients, right? Then we have these societal overlays where as a doctor, you're one of the most respected professionals in the world and in our society. And there is this expectation that you have the answers to all of the medical problems in the world, right? And then patients come into you and respond very positively when you're taking control of their care, and we're able to offload all of our illnesses to you, and you can give us a pill, and we're going to get better, right? So when you put together this, multi-level overlay, we then have this doctor who's expected to have all the answers right away when no one can have all the answers right away. And they then get defensive because they're held to a standard that they don't have the capacity to uphold. And their patients are expecting them to have that and they can't uphold it. And it just causes a really ugly dynamic between doctors and patients. Give me your thoughts on that.
it's definitely true. Also, knowing how much time a doctor has for each patient, it's impossible. Impossible to do any research about patient's case if something is not doesn't go by the books.
Yeah. And there's two sides to the timing as well, right? One part of the time is you don't have enough time with me as a patient. I come to Dr. Karolina and we only have 15 minutes together, right? But then the 15 minutes is not just limited to me. You have to see patient after patient after patient after patient after patient after patient after patient. I mean, who can do all that work in one day? It's impossible. You don't only have enough time for me. You don't have enough time to take a breath in between patients.
Yeah.
It's
My mom,
exhausting.
yeah, my mom sometimes sees 40 patients a day. She
Yeah.
says like didn't have time to go to the bathroom. Like this bad. So how can you help people? How can you don't have time even to listen? So then it kind of come across as very cold, narrow-minded answer like, oh, take this, take that, because that's the only thing they can quickly do.
Now, the reason I'm building this out with you is because I want patients like me, like Matt, and like you when you're wearing your patient hat to be sympathetic to the people we're partnering with. Because if we understand what your limitations are and we understand what your challenges are, and we understand what's going to cause you to be defensive, and we take that into account when we're relating to you and we take responsibility for our part of the relationship, now you can have a better experience with us and we can have a better experience with you. What do you think about that, Dr. Carolina?
I totally agree. There's a lot of psychology, and it would be great to guide patients as well how to handle doctors, and for doctors how to be more open-minded and empathetic. Like we could definitely all collectively do better in those areas. Not only in the United States, is absolutely the same back in Lithuania and many other countries I I studied or lived.
All Western medicine. Okay.
Yeah.
So now let's talk about gaslighting, right? We bookmarked that issue a moment ago, and I want to come back to that, right? Because I wanted to build out this context for us to now talk about gaslighting, right? So I don't like the term gaslighting. I think it's a really dangerous term. I think it hurts patients to believe that they're being gaslit. And I think it takes away the power patients have to take control of not only their health, but their experience with the medical doctor. So I hate the term. I hate it because I don't think it's real. And I think what you're doing is you're outsourcing the control that you have over the doctor-patient relationship when you believe you've been gaslit. But it's the term that everybody uses in this community, and it's the reason everybody failed, and it's the reason why doctors are failing. So I want to get rid of gaslighting, and I want to focus on relationship. I want to focus on responsibility, not only responsibility for our health, but a responsibility for the relationship that we have with doctors. I don't believe in gaslighting. I don't think it exists. I think what exists is an unhealthy doctor-patient relationship, and I believe we as patients, if we take the responsibility for making sure that we have a good relationship with our doctor, that we're going to have a good experience. Give me your thoughts on that piece of my argument that gaslighting doesn't exist and it only disempowers patients.
I really, really like what you're saying. I think it's overused, uh, but it's not absolute. There is there are some intense personalities among doctors. Like there are. I'm personally a very sensitive person, and sometimes when doctors, me when I'm a patient, they can be super mean, like really, really mean, and that just hurts me. So, of course, we are very compassionate doctors. There are doctors who are more neutral. They don't show much emotions, but they're open to listen as much as they have some time to that. We question things. There is a whole spectrum of personalities.
Well, of course, but there are a whole spectrum of personalities of patients as well, right? And sometimes patients could be really mean, and sometimes
Yes.
patients could say really mean things. And we can tell you, even on our social media, there are times when people are saying really mean things to us, right? And Matt, as a patient, will often offload those comments for me to respond to because I'm not sick and I don't have Lyme disease, so it's not triggering for me, and it's not going to have a negative impact on my health. So if patients are being mean to doctors, what do you expect your doctors to do? The doctor who is exhausted because they've seen 40 patients in a day, a doctor who only has 15 minutes to spend with you, a doctor who is put into a medical system where they're not adequately trained to treat people who have chronic illnesses, a doctor who is expected to have all the answers for all the problems in one quick moment. I mean, you have to be better than an AI if you're a doctor. I mean, that's the context in which they're there. And now we're going to be mean to you?
Yeah, yeah, I totally understand it. Maybe in Lithuania it's also more extreme sometimes because we got our independence 34 years ago, and there was a lot of corruption. So it's not that every doctor there is for good reasons or staying there for good reasons. So then you have to deal with doctors who only take you somewhat seriously if you bring some gift to them. Like it's, I mean, it shouldn't be a case, but they are still like now new generation is replacing them, but that generation, for them it's normal to operate on a little bit of corruption, and no
Well,
one's gonna
thankfully,
really care. So,
thankfully
so
we
maybe
don't
that's
have
why I'm
to.
coming, like I don't sound that
All
hopeful
right.
because that's what I had to deal
I
with.
understand.
And they
I
secured
understand.
their spots in these positions that they're still there, but they are being replaced by more,
Okay. Well,
people who are more
thankfully, that's a whole additional overlay that I think we should
right.
leave on the shelf because that's not the American experience. So let's leave the political corruption experience on the shelf for a moment, and let's stay focused on how we can empower our patients and how we should be careful about the terms that we use and the terms that we adopt and the things that we accept. Because I do believe that a doctor-patient relationship is like any other relationship. And for any relationship to be healthy, each party has to contribute to the relationship, right? If Matt and I were not both contributing to our relationship, then one of us would be a parasite and one of us would be a giver, right? Or the host, right? Whereas if both of us are contributing to the relationship, then we're going to have a healthy relationship, and I'm going to like you better, you're going to like me better, and we're both going to have a better outcome together, right? So I'm trying to empower patients, and I'm trying to take away from their experience those things that are preventing them from being sympathetic to the needs of their partner, the doctor, so that their doctor can be sympathetic to the needs of the patient, and together they can come up with a plan that will allow the patient to have a better experience.
Yeah, I agree with it. I wish doctors would be more open-minded and more willing. On the other hand, it's difficult for a patient to re-educate the doctor,
No, it's not.
maybe in
I
my
think
experience.
if I walk in expecting to be gaslit, then I'm going to be defensive. If I'm going to be defensive, I'm going to be triggered. If I'm going to be triggered, I can't be thoughtful. I'm going to be thoughtful, I'm going to be defensive. If I'm defensive, you're going to be defensive. And now we just have this ugly relationship, right? I mean, look, no intimate relationship is going to survive that kind of dynamic, right? I mean, you're not going to date somebody who treats you that way. I'm not going to, look, I'm married, but if I weren't married, I certainly wouldn't be dating or marrying somebody who that I'm not going to be friends with Matt if he's not going to be sensitive to me, and he's not going to be sensitive to me. I mean, that's any relationship. But we take these normal relationship skill sets and we don't apply them to our relationship with our doctor.
But it does have to be a good patient and doctor match, and it's not always the case.
All right.
It's
So
same with relationship. You're
of
not
course it
dating
is.
everyone and not
Which,
hoping that they're gonna change completely.
no, of course, and that's why as young people we date many times before we get married because every woman I dated or every girl that I dated was not going to be a match. In fact, almost all of them were not, which is why I didn't get married until I got married, right? I mean, that's just natural, and you should have that same expectation with your doctor.
That's why I sometimes think if your doctor, if you don't see your doctor as a match, if you tried to have vulnerable open conversation, but it's not going anywhere, change the doctor.
Amen. All right. And if doctor doesn't feel like they can have an open relationship with their patient, perhaps they should encourage their patient to move on to another doctor as well.
True.
All right. So now let's come back to you. Matt is going to join us in a moment. And I want to talk to you a little bit about Lyme disease and ticks. You're the world traveler. You've been all over the place. So the question is, when did you first learn about ticks and when did you first learn about Lyme disease?
Some as a teenager, I've got bitten by tick. Maybe when I was 15 years old, first time. And of course, from all the campaigns of tick-borne encephalitis, vaccines, so I would be hearing about it, and mom would encourage highly. After time spent in the nature, she would encourage to check for ticks. She would help us to check. So that was the education. During medical school, there wasn't much focus on that. Really wasn't. Some on like encephalitis, and then Lyme disease, it was only about bullseye rash and antibiotics. That's about it. Yeah.
So when did you first suspect that Lyme was a problem for you?
First, maybe 3, 4 years ago, when I was returning to the medicine, but from integrative angle. So I'm like, oh, I'll go back to medicine just from the angle I enjoy doing it, and I see that I can support people better. It crossed my mind that I perhaps have it as well, but then I didn't have tools how to test it. So I did what your regular MD would prescribe, immunoblot, sometimes Western blot, but immunoblot test, basic ones. I've done those. It all came negative, of course, false negative. Then I did some Babesia, Bartonella tests, and I'm like, this is already like a stretch. People don't usually run those tests back home. Infectious disease doctors rarely run those tests, but also they are not specific at all. They are not sensitive. So everything came negative. So I'm like, okay, I don't have it. And then I came across some great doctors who do muscle testing that was picking up some Babesia here and there. So I'm like, oh yeah, like I do have Babesia symptoms. Night sweats, very specific, tightness, neck pain, and all these. But it comes and goes. So Yeah, I didn't get my diagnosis only until 6 months ago.
So, all right. So let's now go back to your childhood. What were your symptoms that were developing over time? And at any time during the time either your mother, who was a clinician, was working with you, or any of the other many doctors that she referred you to, um, did anyone ever A, identify the symptomology that you had, and B, did any of them ever connect it to a tick bite?
No. So when I got tick bite when I was 15, I got bullseye rash. And
Or you did
my
get a bullseye rash?
yeah, my mom was concerned. We did not see the tick. I just felt something falling off. I think it was friction between my sock. It was in an ankle, and it just got, I don't know, it fell off. I felt something detaching. And then a week later, I got bullseye rash. And my mom, she's not pediatrician. She works with adults, but she was concerned. She took me to pediatrician, and they said it's nothing. They didn't want to treat or give any antibiotics. My mom was still concerned. She put me on a week or 10 days of doxycycline. That was the best she knew what to do with her knowledge back then. It was 18 years ago. So I was grateful to her. I was happy she responded, she took action. But as we know now, 1 week or 10 days wouldn't do anything, wouldn't do much, and especially to co-infections. So, and then I don't know. So my journey started mostly, all this Lyme journey, mold goes hand in hand. So there was many mold symptoms growing up before that tick bite.
Well, so tell us about that. Were any of the w- w- tell us about the moldy environment that you were living in, and tell us whether or not that moldy environment was a part of the diagnostic experience that you were going through, either with your mother or with any of the referring doctors.
Oh yes, lately it all connected dots. But growing up, our house was not fully insulated. The basement was not fully insulated. So, and the basement was built on like downhill. So there was a lot of different temperatures and it just had a lot of mold. And
Okay.
I was the sensitive one growing up. I had all these allergies. I had symptoms that would come and go, tummy pains, metallic taste in mouth, like many, a lot of histamine issues. But back then I didn't know how histamine issues feel besides allergies. A lot of that. But it all connected dots after last few mold exposures. Last few mold exposures wiped me out completely. It's really true when they say you get sicker quicker. So exactly a year ago, I started working with a doctor in Florida, Alan Gruning, who is a CIRS, Chronic Inflammatory Response Syndrome doctor. He helped me tremendously, tremendously. And I was not responding well to binder cholestyramine, to bind mycotoxins. And he was, oh, I see that in clinical practice, if patients don't respond well to cholestyramine, they usually have Lyme. It's very common. I'm like, Lyme, me? I'm like, okay, I'll do those tests again. I went back home. I couldn't do anything like vibrant or hygienic sphere. I couldn't have access. So I did whatever I could test that regular Western MD has access to. All of them came negative, apparently false negative. Eventually, I came back to United States. I did hygienics, and it showed all co-infections. Immune response, it showed fish test came positive, so it was in my blood, and I started connecting dots. Yeah.
Okay.
So,
So before Matt's going to come and take you through the next part of your journey, but let me stay with you for a second. How many times during the course of your childhood or during your pre-Lyme diagnosis life were you bitten by ticks? You did identify the tick bite when you were 15, and obviously the tick was feeding on you for some time because you felt it detach, not you
yeah.
didn't find it before it detached. How many other times do you suspect you were bitten by ticks that you could count?
Childhood, I have no idea. Then I had one 2.5 years ago. It was in Switzerland. I panically removed it, just pulled it out. Um, and the last one was this May, so or April, maybe April, just after I did my hygienics test. I did that. I got all the co-infections in that test, but I got another tick bite just like a month later. And all it took me like 15 minutes walking barefoot in Lithuanian forest.
Right.
So 3 bites
So,
at least.
so let's before we go there. So I just want to tie together the challenges that living in a moldy environment are going to have on someone who's suffered a tick bite, right? Because one of the things we've learned from many of the doctors that we've interviewed, many of the Lyme experts, such as Dr. Bill Rawls, the author of Unlocking Lyme, for example, is that it's very rare for somebody to go from tick bite to chronic illness, except if they're living in a moldy environment or they get bitten by multiple ticks at the same time. Because mold is so immunosuppressive, if you're living in a moldy environment and you're dealing with the challenges of living in a moldy environment and your immune system is overwhelmed by the mold itself, now you bring in some additional microbes or multiple microbes that come from a tick bite. In many cases, that will cause you to become chronically ill. So, as you were sharing your journey with us, I was wincing a little bit. This young kid living in this, having parents who are good people who want the best for her, but unfortunately, you're living in an unhealthy environment. You're immunosuppressed, and now you're dealing with these tick bites. One clearly lengthy tick feeding bite when you were 15, and despite your mother doing her best and giving you a short course of doxycycline, it didn't help, right? It festered in your system until you ultimately became chronically ill.
This is exactly my experience. The immune system dysregulation component is like the most important. Um, but as I'm saying, like I don't know where I still have so much inner strength, and or maybe it's because I was, in my teenage years, 20s, I was invincible. Like nothing would stop me until it did stop me. And that started with long COVID. I got COVID super early, 2020 February, just before the lockdown. And since then, I'm not the same person. Like it really, really dysregulated my immune system. Since then, I'm in a constant inflammation. Mast cell issues uh, became like out of control. And that's when I started getting more and more Lyme and co-infection symptoms as well. So it
You
was,
know,
yeah.
and of course, the mast cell issue also creates problems with the testing, right? I mean, you were taking antibody tests, and they certainly weren't specialty antibody tests. But even if they were specialty antibody tests, when you have mast cell challenges, it may be making antibodies for something you don't have. We're not making antibodies for something you do have, and that's why you're getting a lot of false negatives and false positives with antibody testing. So, why don't you talk a little bit about that while Matt comes in and he's been taking a lot of notes, so I know he's a lot of questions for
And
things that
I'm
I
sitting
missed during
here
this interview.
patiently waiting, Rich, patiently
All
waiting.
right, Matt, you're up. Come on now.
All right. So, Dr. Karolina, I want to, before we even get into any of that, though, let's pull back because coming from this family of doctors and having your medical background, what were you doing to help improve your health when you were having these odd symptoms before you got to the root cause and knew that it was mold exposure and Lyme disease and long COVID? Was there anything you were doing that alleviated your symptoms or you think helped you looking back before you got your diagnosis?
Ooh, I didn't have many tools on hand. In medical school, again, nutrition is ignored, right supplementation is ignored as well. What really helped me, I think, that I always had some hobbies and interests that really kept my life force, my chi flowing. So, like I always love dancing. It generally makes me happy. It resets my nervous system. I started doing yoga also pretty early, around the same time when I got tick bite, 15 years old. And I didn't know anything back when I was 15 years old. I didn't know anything about fight or flight, sympathetic parasympathetic nervous system, but it would just feel so good. I would always feel like I got a reset to my nervous system, and I kept doing yoga. Back then, we didn't know terms as breath work or like meditation wasn't used as a term. It's just a normal 90 minutes yoga class. So that's been helping me tremendously through those years. And then
So
spending time in nature, and of course, we had access to very natural, organic food, fresh from farms. So I think all those things were really helpful.
what are your thoughts on being a traveler? Because you mentioned earlier from Lithuania to Hong Kong to London to US, you were on the East Coast of the US in New York, then you were in LA, right? Do you think that you were exposed and maybe bitten numerous times and you had various strains of Lyme disease and or co-infections? Because a lot of the researchers we talk to tell us that different strains of Lyme can cause different severity of symptoms. And if you're a world traveler like yourself, maybe you were exposed to far more things than you've known, and that's contributed and kind of dogpiled on to you all of these things that built up over your lifetime.
I can totally see that. I'm not aware of any tick bites, but of course I'm aware that most of them we don't detect. One of my co-infections is tick-borne relapsing fever. It was not any like Europe, Lithuania is not endemic area. At least it wasn't, but now there are cases. Just there's no testing for that, which is ironic. Like we do need testing because there are cases right now. Probably because of traveling this much, and I traveled to many countries, like 69 countries, and lived in many, and so on. I think I got also a lot of like opportunistic bacteria or maybe parasites or these things, but also weakened, already weakened immune system.
Yeah. Yeah. And as we know, these opportunistic pathogens, viruses, bacteria, parasites, they all come out when you're immune compromised from Lyme. So, picking them up from all around the world, I mean, 69 countries is a lot. So that's I think, a good background here. But let's also talk about now the value of the things that you were doing, because fight or flight's key, your diet is key, your nervous system is key, and you were doing these things but didn't fully understand why until you got a little bit further along. So I sensed a pivot from Western medicine to naturopathic medicine, right, or functional medicine. And it seems like your own health issues brought you across that bridge. So is that really what happened? Your own health issues and the lack of support you felt you got from Western medicine brought you over to this more natural side?
Absolutely. It was eyes-opening moment when I um, first visited integrative medicine doctor, and I've been listened for the first time. I came to her to do neural therapy on my scars, and she listened to entire health story of me, and she said, "Your fatigue is not normal. We should work on this." I'm like, "Work on my fatigue? Is it even possible?" Like, it's beyond my dreams. Like I always like the fatigue was one of the most my intense symptoms. So I always wish, like, if I had to make one wish, it would be like just get my energy back. And and someone listened and someone said that we can fix it. I'm like, wow, this is incredible. And then she hinted, it's, oh, you have this great background of Western medicine. Why don't you study integrative medicine and functional? And why don't you learn more? And it was at the time I was so discouraged. I'm like, I don't know if I want to do this. I'm like giving up on this. But then it set in what she said, and I'm like, oh, yes, there's actually so many answers. And then I started observing people, and then I started seeing how just so many people around me also dealing with many symptoms that could be improved, and they don't need to live and suffer from that for the rest of their lives.
Were you treating medicine? So were you a practicing doctor before you got sick and before you had this pivot?
Before I was, but then I took few years of break to explore other career options. I
Okay.
also, because of this increasing fatigue, I just couldn't work 8 hours per day. I couldn't do night shifts. I couldn't do anything where, I don't have an option to nap if I need. So I
Yeah.
had to look for careers or jobs that is something more either flexible schedule or project based where I could rest afterwards, or something I could do from home so I have my bed and I can nap. And I just thought, oh, this is the way I am. So I just gonna design my life around it.
So what kind of doctor were you before you had that little bit of a career change before you pivoted back to functional medicine? Were you working as a regular primary care doctor? Were you working in emergency medicine? What kind of job was it?
So general medicine, yes, I worked a bit in emergency care, and then because of night shifts and everything, I pivoted to aesthetic dermatology just because, not only just because, like I do really admire it. There's a lot of also toxic psychology in that field, but I love anything aesthetic as long as it has a healthy approach in it, but it doesn't have night shifts. And that's for me like, oh, this is amazing. I can build my own schedule. I can take as many patients I want. And that was working out for me
And
at
during
the
this
time.
time, did you experience any patients that you were treating, whether and even in dermatology, right, or even in your general care or your emergency care, that you just were stumped by, and that you're looking back, you think could have been suffering from a tick-borne illness?
Um, from patients, it's a bit blurry memories, but more from friends. From friends, yes, because I got more time to get to know them better
Got
versus,
it.
you see a patient very briefly.
Yeah, in and out. So now you're you're practicing medicine, you pivot over to dermatology, and then you said that you made a little bit of a career change before you got really sick and pivoted over to functional medicine. So what was that career change? What were you doing before that?
Skincare products.
Okay.
So yeah, doing research for skincare companies, for like best ingredients, trendy ingredients for like consumer-driven market, and yeah, what new products to release. And
Yeah, and I want to come back to the aesthetics because you said that you really love the aesthetics business and you love, obviously you took that passion and you went into the skincare business. But I want to come back to that because I still want to focus on your experience. So you now back to where Rich was, you go and you get your diagnosis. And this was just give us context. This was a little bit after COVID. So I'm sorry, this was just within the last year you got diagnosed, correct?
um,
About last
so
year or
aesthetic
so?
dermatology was right after medical school. It was like 2018, 2019. Then I got
Oh,
COVID 2020, and then I got CIRS diagnosis exactly a year ago, and Lyme diagnosis 6 months ago.
got it. Okay. So for everybody listening, if they don't know what CIRS is, can you just explain, obviously it's chronic inflammatory response syndrome, what that is and how that impacted you?
In simple words, it's immune system dysregulation and usually like caused by biotoxins, usually mold. So mold can affect us in different ways. And in medical schools, they teach doctors only one way. So it's allergy or like aspergillosis, systemic, where you have mold in your blood, in your system. So, but they never teach you about mold sensitivity and mold toxicity. That's very common when people get exposed to mold and they get all type of symptoms from neurological, psychological, gastroenterological. The moment they move out, their bodies detoxify, they may help their bodies with some binders, and they bounce back to normal. And the third, so I knew about this from like functional integrative medicine, but the third group of patients, when they get exposed to mold, even when we are out of exposure, they don't bounce back to normal. Their immune system is dysregulated. So now you have to support that as well, not only get the mycotoxins out of the system. So I fall into that third group. I moved out of the exposure. My health kept going downhill.
Okay. Okay, so I just want to make sure I understood that. So there's three buckets or groups of people that suffer from mold. The first one is, and I think that's the part that I didn't fully understand. The first one is where you're exposed to mold and you don't really respond to it. Is that correct? It's just sort of
Oh no,
somebody.
the first
No,
I was mentioning allergies. So usually if you go to a doctor and you say, oh, I think I'm reacting to mold, they would not consider that you can be mold sensitive. They would only consider that you may be allergic, and they would run skin patch tests. And I've done all those tests. Like it would always come negative. I'm not allergic to mold,
got it. I
although it
understand.
still damaged me a
Right. I,
lot.
I understand. Now, so you go to an allergist and they say, are you allergic to it? And no, I'm just sensitive. And if you, then the next part of that discussion you had was where you can be exposed to mold, be symptomatic, be taken out of the exposure with some binders and maybe a little bit of work, you're back to normal pretty quickly. And then the third bucket or the third grouping is somebody like yourself and a lot of us in this chronic Lyme community where you're exposed to mold. you're removed from the exposure, you do things like binders, but you really struggle to regain your health. And I think that's kind of what you were describing in your explanation.
Exactly. And the third bucket is really underlooked, but
Yes.
they need the most support. It actually should be prioritized. Like,
And Dr. Karolina, I am a firm believer. I know so many people, young women, young men, all ages, people that you think are healthy in their early 20s, their teens, that are struggling greatly with CIRS and MCAS and all of these diagnoses that they don't really understand the root cause to, that could be related to potentially mold and Lyme and a couple of things together causing the perfect storm. So I think that's a bigger problem than many people are aware of. So let's talk about all of this too, and then tie it into COVID, because when you got sick with COVID in 2020, that sounded like that was like the big trigger where your body just couldn't handle it anymore. And then Lyme, the mold exposure plus COVID really crippled you. And now that was for you I'll say your perfect storm. Is that really what happened?
exactly.
Okay.
Yeah.
So what did you do to recover from COVID? Because as a doctor and now having some functional medicine ideas, when you didn't even know you had Lyme and everything like that, what were you doing with COVID just to overcome that?
I'm still overcoming. I'm still learning. We
Yeah.
still don't know so much. It's such a different one. It's just
Well,
supporting body systems, supporting my mast cells, supporting my immune system, supporting my nervous system, but specifically to target spike protein or that it's difficult. I've done like blood filtration, apheresis. Not sure if it helped. Maybe a little bit, I'm hoping, but what else can I do? I've done some of those protocols for like spike protein detox protocols. Did that help? I can't tell. Maybe I need to stay many more months on that. But I'm doing other protocols. I don't want to overdo as well and overwhelm my system.
yeah, yeah. So now the other thing that I wanted to get into is when you got diagnosed and now you're going to this functional medicine doctor, this again 6 months ago, what was your first thing to do to treat the Lyme? Because there's so many options, especially if you're functional minded, right? What is your path to start addressing the Lyme disease?
Herbs. So I really like my doctor's approach. I'm so grateful to him. He started from fibromyalgia, then he done shoemaker certification. He's treating mainly CIRS right now. While treating CIRS, he realized Lyme is more common than not as a component and all that. So he diagnosed me with Lyme and he built me a protocol of herbs, titrating, reintroducing one by one, building it up slowly. I do really like it. It helped me with many, many symptoms. So I'm still taking it, I'm still doing it, and I'll see what's next. Sometimes it feels like I hit a plateau and I don't know if like what to do now. But when it starts working again.
Yeah, and I think that's important what Rich was saying earlier. I mean, you are a very smart doctor that comes from a family of doctors that has also a functional minded approach to healing in addition to your Western training. But when you are the patient, you have to partner with your doctors because it can become overwhelming to make decisions around your own health, even as for somebody as smart as you. So leaning and trusting on your doctor as a partner to help guide you takes a little bit of that stress off and helps you come up with a plan that you agree with and move forward. So is that kind of what you've been doing, is working with your doctor to together come up with a plan and your next steps as you're stepping through this together?
I was mostly following his ideas, and in between consultations, I may explore something myself. I'm like, oh, I've been taking zinc supplements to help my like zinc L-carnosine to help my stomach lining, but I never supplemented with copper, so I may have copper deficiency. So some things I come up myself and I test it, and then I show him, and then he
Yeah.
responds. But I really enjoy just being a patient instead of instead of trying to always be my own doctor, be my own this and that. And it's been really, really helpful. What also has been super helpful, I asked him to connect to refer with some CIRS coaches, CIRS therapists. So I've been working with this lady for 1 year. She's been a support, when no one else can relate what you're going through. Because I had the worst year. I was bedridden more than half of it. She's been really there for me and really, really supporting and validating everything what I'm going through. So That I recommend for many people in going through chronic illness.
Yeah, and I also think, although your doctor is very informed, in addition to CIRS and MCAS and all the histamine stuff, in the Lyme community, we have ILADS, the International Lyme and Associated Disease Society, and there are some really powerful experts when it comes to MCAS. Rich actually met Dr. Tanya Dempsey at ILADS at their conference in person and interviewed her, and we're having her back in a few weeks. Actually, we're interviewing her for a special event next week, and then we're having her back for a long form podcast in a couple of weeks. But she's actually done the most research in the MCAS community, and she's the leader in the Lyme space with MCAS and has a whole approach now based on her study. So when you have doctors that are open-minded and they're willing to confer and collaborate with others, leaders like Dr. Dempsey can help collaborate with other people in the community to help educate them to then better treat patients like yourself. And I think that's really the goal of iLads and Tick Boot Camp and everything you're doing, because together we can gain a lot of knowledge and help this community. But individually, it's very difficult to do that.
Exactly. I totally agree. We should bring back like boards, like what's it called when doctors get together and discuss patients' case.
Yes. Yeah.
Yeah.
So, we're with you there. Now, but specifically, what kind of herbs did your doctor or is your doctor using? You mentioned antimicrobial herbs, but do you know any of the specific types of herbs? Are they blends? Are they in a tincture? Are they in a powder form, a capsule form?
Tinctures of single herbs, and I do really like that approach because then you can see what you're reacting to, what not, and how to increase it. I started with Hotinia. It tremendously helped me within first week, helped me with my joints pain, entire body pain, where I could not stand up quickly. Like it would take me a minute to stand up or get off the car. It would take me so much time to start moving, and that was only 6 months ago. And within 1 week, that symptom is gone. It comes back sometimes.
What herb is that? That was Hotinia? Is that what you said? I'm probably saying it wrong.
Yeah, Hotinia. It's a very complex spelling, but yeah, Hotinia. It's from
Hoot.
Double T.
I'm Googling it now as we're speaking, so it's like I don't want to butcher it. Do you know how to spell it or approximately?
Houttyun.
Oh wow, you are good. Oh my goodness, I never would have. I Google was like, Matt, you're so wrong. It didn't even give me any accurate results. You started spelling it, it came right up. You're spot on, Dr. K. So it's Houttyunia, Houtinia. I'm butchering that, but
yeah.
So
it's
that herb
from Stephen Berner's protocols. So
got it.
He just picked that based on my co-infections profile. I think Babesia and Bartonella are my dominating ones. So that was a great entry. And then Cryptolepis is super, super powerful. So that we introduced later on.
Yeah.
Drop by drop. Now I'm full doses, 30 drops twice a day. But it took me 2 months to reach a full dose.
Right. And I'm going to butcher it. I'm sorry. Houtinia is a NutriMedics product too, which is a very popular back name in our community. So I think that was really cool because that got you within a week with some of your joint pains. That's really powerful information. When you mentioned Cryptolepis, that is more of a strong antimicrobial. And if you're sensitive and you're going to herx, it could be causing a flare. So You mentioned you kind of slowly went into that. But what kind of symptom relief did you experience from Cryptolepis?
I herxed from both pretty badly. I did not experience any sudden symptom release. I think I was already like more stable, but I do have still very bad withdrawals if I run out of my herbs. Sometimes I just go through it and I didn't order in advance. And I've been hearing that people get, when they take antibiotics, pharmaceutical antibiotics, they do feel great until they stop taking it, and then they feel worse even than before. Same happened with herbs, like they are so potent and so strong. I had full-on cytokine storm, brain inflammation. First, I couldn't connect dots, what triggered what, because it's so difficult. But that pattern repeated a few times, and I don't want to run out of herbs again. Well, at least until I'm done with my treatment.
Yeah, I think it's important because with herbs, the key is consistency, right? And following the plan that you have with your doctor, because you have a plan. You want to work your way up and you don't want to just come off, because all of that supportive natures of these herbs, right? So the detox ability, the ability to, help flush everything out of your body, if you're still killing off microbes and you're not having that support to flush out your liver and help your lymph system and help with the toxins, then it might not be an ideal situation. So were there any other powerful herbs, the Hutinia, which I apologize, the Cryptolepis, was there anything else that you used that you felt was noteworthy?
Oh, I tried many of them. I'm sure they are helping, but nothing
Okay.
now that.
Okay. I know you mentioned in your pre-interview questionnaire that you had Lyme stop in your response. Have you been to Lyme stop? Because we've had a handful of people on the podcast go there, and we've heard varying things about Lyme stop. But if so, can you give us a little bit about what it was like and what your experience was there?
Yeah, I did it a month ago. I went to Idaho. It's too early to say something. So far, I liked it. I know my expectations. It's like with any other treatment, either it's herbs or antibiotics, there is a chance that it's not going to do anything to you. But for some people, it can be life-changing, life-saving. So I have my expectations right. It's like a little bit of a lottery. It's trial and error. You see what works for your body. So far, I really liked my experience. He also put me on a whole different supplements protocol, and I think it was time for me to go on a new protocol. I was for 1 year with my doctor from Florida, CIRS doctor, Alan Gruning protocol, which I also liked, but um, I do see improvement in health. Some symptoms also intensified, so it's difficult to tell, but that's expected. They warn you that there can be a die-off, you can feel worse. So for the next few months, I would say I experienced both. Some symptoms are more intense, and overall, do have more energy at the same time.
That's
So
great.
something changed, something moved, but
Yep.
I can, yeah, follow up on that in the future.
Yeah, and healing is not linear, right? I mean, in order to move forward, you're going to take 5 steps forward, 3 steps back, right? So it's
Yeah.
always going to be this up and down, up and down. But when you look back to where you were a year ago, and in a year from now, you're going to look back to where you were today, you're going to realize that, you're moving forward. But the key is you have to try. You have to take steps. You have to try different things. You have to try a protocol. And then when you look back, you're going to realize how much progress you've actually made. So let's also talk about the diet side of it. 'Cause I do know that you are a heavy keto diet person. So again, we've heard varying things. Some people say the keto diet saved my life. Other people said it's really dangerous. You shouldn't do it. So, can you tell us how you found that diet and what specifically it has helped you with when it comes to symptoms and your illness?
Yeah, so I've been hearing about it doing miracles to people for a long time, but I felt that I was already on restrictive elimination diet and my life just became so restricting. I didn't want to restrict it even further, uh, stopping eating things that were bringing me joy, and my diet was already good and clean. So I wasn't sure if keto is going to do anything to me. But then I decided to go on 2 or 3 days fasting, which uh, on the first day, I already started feeling improvement, a tremendous improvement. My inflammation, so I would be waking up with low-grade fevers for the past 2 or 3 years almost every morning. So always an inflammation. First and second day of fasting, no inflammation, no low-grade fevers. While I was still a bit weak because, first few days of fasting, you feel a bit grumpy and it's like you have to adjust, stomach has to shrink, and I was still feeling pretty good. I'm like, way, way better than the day before. So I kept going. I did 7 days of fasting and I just didn't want to introduce same foods, that I realized how much impact food was doing to my body, and something that I was eating was feeding my inflammation and my infections. And then I just, okay, I'm gonna exit my fasting with keto. I'm not gonna spike my blood sugar, I'm not gonna feed infections. So I was doing a lot of fish broths, bone broths, um, what else? And veggies. I would be introducing veggies one by one.
Mm.
Zucchini, cucumber, raw carrots, not cooked. And I stayed on that for 3 months, although I know the downside is that If you don't give carbs to your thyroid, that can get weaker because your body, your adrenals have to work so hard as well to get sugar from liver stores. So yeah, my thyroid is not very happy about it. So now I'm trying to find a way how to still stay in this high protein, some fat, and a little bit of carbohydrates. So I'm doing some blueberries with meal, not by itself, so it doesn't spike my blood sugar. Strawberries, piece of apple. So I'm trying to find a way that my body is happy and I also don't cause long-term damage to my thyroid and adrenals.
Yeah, I heard, and I don't know if it's true, but I've always benefited from smoothies, and I make smoothies several times a week. And on the weekends, I generally do them for lunch. And the mistake I was making, I think, was I was using, strawberries, blueberries, sometimes pineapple, banana, whatever I had around, and I'd make that with some almond milk and throw it with some protein powder in a smoothie, and it would be my lunch. But then I think with all that fruit, I was having a crash from the sugar, right? And somebody told me, hey, put a scoop of peanut butter in and try that. And I'll tell you, I actually noticed the difference because they're saying that the fat in the peanut butter, would actually help level out the spike of the blood sugar and not have the crash. And I actually felt it. Like I actually felt a difference. And I had sustainable energy until dinner by having that first smoothie and replacing the peanut butter with the protein powder sometimes. So I'm just curious if you've tried that and what your thoughts are on that.
Oh yes, always. If I do have anything high in carbs, I coat it in, let's say I take some nuts, nut butter or something fatty with it. So the release of carbs is slower. Always.
Yeah.
Yeah, I always do that.
So I did want to circle back to your previous comment because you were selling skincare products. You said you love aesthetics, but it's really difficult to balance skincare and health, especially when you're talking functional medicine, because we know that many skincare products have a ton of toxins and they're really bad for your hormones and your endocrine system, and they're just very toxic and they cause a lot of problems. So how are you balancing the passion you have for aesthetics with the passion you have for health and balancing it in a way that's healthy?
Oh, so when I moved to more e-commerce side and more products, it was all organic and making it, as clean as possible. So it wasn't any conflict. I really enjoyed it actually to create some more products that are non-toxic.
What are your thoughts? Because we've had other people come on the podcast when it comes to, your physical appearance and your health. So in addition to health, skincare, like makeup, what about things like tattoos and piercings and also cosmetic surgery? So we've had people come on and say, I've had breast implants. I've had, butt lifts, and how they had regrets because they felt that the breast implants or the metal in their body from, the piercing or the tattoo really compromised their health and was a contributing factor to their unwellness. What are your thoughts on that?
They do contribute a lot. There's also so much we don't know, or because the marketing of some procedures is so loud that we don't even consider side effects. Even, Botox, botulinum toxin, and fillers, they sound innocent. They are not at all. There's like scar tissue building around fillers. Although all these filler companies, for injections, for lip injections, cheek, jawline injections, they say that they are very natural and similar to our own hyaluronic acid and they dissolve every 2 years. Now, because we see history of decades, it does not dissolve. It stays in people's, faces, tissues for decades. They never dissolve. There is almost like a capsule building around, which is inflamed, which is hard. If you press on it, it hurts. So yeah, always less is more. And then Botox, again, it's a toxin, it's biotoxin.
Right. But, I mean, it's something that's not natural to your body. And even if they're saying it's dissolving, it's still something that's foreign. Your body's going to see it as an invader, and you're probably going to mount an immune response. And it probably is toxic. And it's probably, there's a lot of impacts to it. And I've always heard people say, especially in the chronic Lyme community, that, oh, I have really bad migraines, and the only thing that helped me was Botox for my migraines. And I've always thought that, okay, maybe it's helping with your migraines, but what else is it doing in a negative way? So what are your thoughts on Botox for migraines?
Please first explore other options. There's always many options. People think they only have few options. They tried medication, and the second only option is Botox. It's not like, don't jump right into that. It's really, if you are desperate, exhausted all the options, then consider that, but also make sure your body can receive that. Let's say people with mast cell issues, they don't do well with Botox at all. They flare up, they react, and sometimes reaction is few days, sometimes few months until it wears off.
Yeah, talk to us about, because you're mentioning, a lot of we're talking about here CIRS and MCAS and histamines and inflammation. And another common thing that we see people want to use in the Lyme community to treat Lyme and help the body repair cells and also go after the infections that are hidden are things like stem cells and things like that. So, exosomes, et cetera. So what are your thoughts when it comes to stem cells as a potential tool for Lyme, especially when so many of us have histamine and MCAS issues?
Yeah, that's an area I haven't explored much. Um, for me, when I hear it, it's like, oh, this is financial stress because they are so expensive. And we
Yes.
want to decrease our stress. So even like finding a practitioner, some of the prices I see, oh, this would cause me more stress actually than healing because it's a
Yep.
financial stress. So I think stem cells is a little bit out of the picture for me. So I haven't explored.
Yeah, talk to us about muscle testing because you said that earlier. And we've heard about muscle testing, and so many people that listen to this podcast are like, "Hey, muscle testing is crazy, right?" And I'm going to pretend, I'm going to have a conversation that I had with somebody, a personal conversation I had with somebody, in my own life, and they say, "Hey, muscle testing is so crazy." People come up to you, they hold up vials to your body, and they say, "Oh, are you getting weak? Are you getting strong?" And they do all this woo-woo stuff, and it's not real, and people are crazy. I'm like, look, I used to feel that way. You don't understand. From Tick Boot Camp, I've learned a lot. You got to give it a chance. You got to look into it. But how do you overcome the barrier when people, and well, I guess, how did you personally overcome that barrier to realize that there's value in muscle testing when there's so much, negativity and people not fully understanding how it works? So that's probably the first question I want to ask you about muscle testing.
Yeah, I've been so fascinated by muscle testing, and the advice would be find a skilled muscle tester. Muscle testing is as good as the person testing you is skilled. And also have in mind there is no perfect test. Like all tests have limitations. Even if you run something, in lab like a GI map, you collect one day you're gonna get one set of results. You do it next day, you're gonna get different set of results. So no test is perfect. Muscle testing has its limitations, but it's the quickest, the most efficient way sometimes to spot something, that otherwise it would be difficult to test.
Right.
So yeah, it really takes finding a good practitioner and being more open-minded to that.
But tell us how it works and give us some of the facts and the science to remove the mystery behind what muscle testing is.
I wish I could remove a mystery. It's where, science itself also has limitations, and we
Yes, it
always
does.
question science. I know super skilled doctors who are super skilled in muscle testing help thousands of people, and they say like, just believe it. Like you can't really explain fully, but it's a biofeedback from the body. It's a response from your body. It gives about the question you ask, the trigger you put
Right.
in front of it.
I think that's a very good way to describe it. So I know we've had you for a while, so I want to ask just one or two more questions before Rich picks back up and concludes this brilliant interview that we've been having. But I am fascinated by the nervous system. And you brought that up a lot earlier on with Rich, right? I am fascinated because I know my own personal Lyme experience. I was severely in fight or flight, severely, didn't realize it. And I know I still struggle with my nervous system and I'm aware of it. And I have a ton of tools and a ton of measures to address it. But I think it's probably one of the most major problems we all deal with in the Lyme community, which is we're overstimulated, we're in fight or flight, which inhibits us from healing. And that's something that I think all of us need some guidance on. So you talked in your pre-interview questionnaire, you mentioned you did some vagus nerve stimulation, some limbic system retraining, and some other things when it comes to regulating your nervous system, which is an absolute must in order to recover from any illness. So can you tell us your thoughts on if you agree with my assessment of the nervous system, and then also give us, an evaluation of the tools you've used to help address it.
Yeah, I absolutely agree. It's super, super important. What tools I used. So having this therapist, this coach helped a lot because it rewires limbic system, especially between sessions I do journaling, so and then we discuss. So everything helps to release what's been stuck in a body.
When you say, sorry, Dr. K, when you say the coach, were you working with like a one of the major neuroplasticity providers? Can you tell us who that
No,
was?
it was my CIRS coach, a person who helps you to navigate when you get a CIRS diagnosis and you don't know where to start, how to start designing your life, how to do anything, because every step you take is impacted. So she was there to help with that, but also alongside we did what we call limbic system retraining, but it wasn't any particular program. So it was like a therapy sessions, and in between I would journal by myself. All these things help, even writing things down and using your hand instead of typing, that helps to rewire, get things out of your system, get stuck emotions out of the system.
Interesting. So handwriting things is a better tool than typing things when it comes to neuroplasticity and when it comes to your nervous system techniques.
Apparently, yes.
Interesting.
Yeah.
Yeah.
What else helped me tremendously? I did Vipassana meditation, which is 10 days meditation, 10 hours each day in silence, no contact, not talking to anyone, not
How hard
journaling.
was that? Are you a talker like we are? Because that'd be very difficult for me and Rich. We'd have a
It
really hard time
was
with that.
it was super hard, but I was so sick before that. I'm like, I have nothing to lose. Like, what else I gonna do? You know? And I needed, because as you said, like we have a tendency to run on overstimulation.
Yeah.
And I just now realized, only after this meditation experience, I realized that, oh, my entire life I was chasing stimulation, like all these fun travels and moving abroad and all that sounds fun, but my system
69 countries. Yeah, I'd say so.
sounds fun, but eventually your body breaks down. So it's definitely contributed to that. So I'm just relearning, I'm learning slow living, just being in a moment, in quietness, doing everything slowly instead of rushing, overcommitting, overdoing.
Are
It
you
changed
back
me a
to,
lot.
oh, sorry, interrupt.
No, I'm just saying it changed me a lot. So that was very profound experience, and it's really what I like about it. It's accessible. It's really, with chronic illness, everything is so expensive, everything accumulates, and this thing is for free. Like you go to the center, you maybe later you can leave some donation if you felt like. That's it. So I wish it would be talked more about it.
Yeah.
It's such a great tool.
And there are a ton of YouTube videos and online resources that provide free or very low cost neuroplasticity and brain retraining tools, which in the end will regulate your nervous system, which have the biggest impact on allowing your body to do what they were designed to do, which is heal and regulate the nervous system and fight off all the bad things that we've acquired over life, right? So I think that's really, really key. But I can't help but think, being a doctor is stressful, right? Now you are, it sounds like you're working towards becoming, going back to being a practicing doctor again to use what you've learned to help others in the chronic illness community. But are you concerned that that amount of stress and potential burnout will have a negative impact on your health and maybe set you back? And how are you protecting yourself and setting yourself up for success for the future to help others, but also not hurt yourself?
Listening to my body more, trying to understand when to stop, what are my limits, and my limits are changing every day, every week, so it's always this negotiation with life, how not to overdo, when to stop, and when also you don't want to stop completely because you won't progress. So also I have to feel when I can actually let myself to do something else, some more like higher workload or more physical activities. So it's always listening to the body. Yeah.
Yeah, no, I agree. And when you said vagus nerve stimulation earlier, is that something? Was that a technique where you actually stimulated the vagus nerve somehow? And I'm curious what that was like, and if you felt like it was a good tool or a good treatment to try.
It's good. I see for other people, I see great results. Myself, I'm a bit like been inconsistent with it. And when I tried to be consistent with it, I was still in exposure so I couldn't personally feel benefit, and that was the biggest roadblock. And I want to elaborate on this a little bit more because maybe some people are gonna find it useful. It's a whole different topic, but I was trying so many different healing therapies that in theory should help me, but nothing was helping me because I was still in exposure and it wasn't mold. So I moved out of mold a year ago. And I thought, oh, from there on, I'm gonna start feeling better and heal. I went back to my apartment in Lithuania, and I started feeling significantly worse each day, and my Lyme manifested in full force. That was the first time, like this January and February. And actually, the reason behind it was endotoxins. So it was a leaking pipe that was kept open for 6 years. So it was emitting all these bacteria endotoxins in my apartment for 6 years. And if I didn't find that, yeah, that's why like nothing I tried vagus nerve stimulators while still living in
Yeah.
that apartment that looked super clean. It's pretty brand new. It's 6 years old, looks clean. There's no water damage, no mold, but behind kitchen cabinets there was left pipe open, and that was the most big roadblock for me. And also my Lyme got much worse since then. So I just wanted to share this so that I know people would pay also more attention, not to stress anyone, but endotoxins and sewer gas matter as much as mold.
Yeah, and you're giving us so many little nuggets of gold here as far as tips for people, because one is if you're doing things and not getting better, you should look to what are some chronic exposures like these endotoxins and sewage and mold and heavy metals, right? There are other things to look for because there might be some other missing piece that's above and beyond Lyme that's keeping you sick and suppressing the immune system, number one. Number two is when you're doing things like vagus nerve stimulation that may, right now, if you did it, have a positive impact, you can't evaluate whether or not it was a good tool for you personally because you were so exposed to toxins and immune compromise when you did it that you can't really fairly say, was it a good tool or not, right? So that's a very, I think, logical way to approach that particular piece of it. So, I do want to ask, because people listening, my final question, I'm going to let Rich pick up and conclude because we've had you for more than we probably should have now, is what are your plans to move forward with helping others and becoming a practitioner again? And what are your next steps in the coming months in your own personal healing journey and, building back up your medical practice to help others?
I'm still navigating it. I approach it with curiosity as, a journey of life. This chronic illness flipped my life upside down, but it also changed me in a very, very good way that I see now silver linings and all that. I see the bright side and the meaning in that, although it's still very hard at sometimes. So I don't know. I see so many opportunities where people do need help. Here, Europe, it's irate Lyme, mold world, they're so connected. So we'll see. I try not to put too much pressure now on myself to figure it out and jump right in to save a world because I need to save myself a little bit first. But we'll see.
Well, I think it's really exciting, and I just wanted to follow up with Matt's question, which to you was, well, how can you make your way back into the clinical arena and keep yourself healthy at the same time? And I have a suggestion for you, Dr. Carolina. I think the way to do that is to move into the community and develop healthy relationships with your patients. There clearly are not enough people who are treating people with Lyme disease. There's clearly not enough doctors treating with people who have mold illnesses. And all the experiences that you have personally put you in a unique position, I think, in two particular places. And one place it puts you in a unique position, and which is one of the reasons why I recommend that people who have Lyme disease only work with a doctor who themselves have had Lyme disease, is because I think only somebody who has been on the journey knows when it's time to try to push a patient a little bit so they can progress, and when it's time to walk things back a little bit so that they're not treating too aggressively and perhaps causing themselves a setback. And I think you're in a very unique position because you've been on this journey yourself, and you'll know when there's a plateau and when it's time to push, and when maybe somebody's pushing themselves a little too hard, and it's time to walk it back so they're not hurting themselves into getting themselves too sick. But the second thing that I do want to share with you from this really cool interview that we've done together is I think only a doctor who has been on the journey understands how to develop a healthy relationship with a patient who has Lyme disease. And you've certainly demonstrated that you know what it's like both as a patient and as a child and as a person who had to deal with medical doctors through medical school, what an unhealthy relationship looks like. So you have the ability to now develop this healthy relationship, which will be good for both you and your patients. It won't cause you to get sicker because you're going to be in a healthy relationship where you're empowering patients, and patients are going to help you to heal because they're going to be in a healthy relationship with you and they're going to be giving to you. So I'm actually really excited about you coming back into the clinical space because I think you're going to have a journey very much like Matt's, where Matt was very anxious early on. Matt was struggling with his health, but as Matt went on and he started to help more people, they started to pour into him, and it allowed Matt to get better and better and better and help him to overcome his illness. So I think getting you to the final piece of really having regained your health will come now that you're moving back into the clinical space.
It's a beautiful way to put it. Thank you so much for sharing. I do really believe in collective power of people, helping each other and encouraging, and then it's just exponential. So, yeah.
Yeah, so I think as we move away from places where doctors are not making patients better and patients are not making doctors better, but we now come together and have healthy relationships, everyone gets better in that environment. And I'm really excited to encourage folks to work with you. I'm really excited to see how you get better while you're pouring, your beautiful spirit into other people, and other people are now responding to that. And as they're getting better, they're going to help you to get better. So how can folks get in touch with you, and how can they work with you now that you're moving back into the clinical space?
Social media, and if you could attach my email, then it's the best way. Yeah, I'm redoing my website because this health roller coaster flips my area of focus and everything. But eventually it's gonna
So
relaunch.
spell that out for specifically so the folks who are listening, and Matt, of course, will put it into the show notes, but give us specifically, where can people find you?
Social media, it's DrKaroMD. So Dr. Karo MD. That's the best way. There's my email there as well, which is a bit
Oh,
longer. So
okay, well, give it to us. Give us the email. What is it?
Dr. Karo, Drkaro, at healthconsultant.com, but consultant is with a K.
Okay,
Health
very.
consultant, yeah.
All right, so that is really cool, and we've been big fans of your Instagram page. It's really very well done. So congratulations on the great work you're doing in social media. And with a very small number of posts, somewhere in the neighborhood of 50 posts, you have almost 100,000 followers. So it makes us very jealous as
Oh,
folks who have had thousands of posts and only 20,000 followers. We're
I've been
very jealous of
repurposed.
your great work.
Yeah.
So congratulations, and you're making great contributions to the community with that. So again, we really were blessed to meet you, really blessed to learn about your journey, and really excited to see the contributions you're going to be making for the folks in the Lyme disease community. So thank you.
Step by step, yeah. Thank you so much. Thank you for what you're doing. This is so incredible and so much needed and so supportive.